Welcome to a video that can make a difference to your health. Today, we'll explore a critical topic that affects many people around the world: the symptoms of gastritis. Gastritis is a gastrointestinal condition that can be painful and uncomfortable, but can also go unnoticed in its early stages. Knowing and understanding these symptoms is vital to taking proactive steps towards your digestive health. Therefore, I ask you to subscribe to our channel right now and follow every detail of this video, as the information we will share here can improve your quality of life. Gastritis is not an issue to be ignored, and understanding its manifestation is the first step towards adequate treatment and prevention of serious complications. Be sure to subscribe and follow this crucial video for your health. Gastritis is a medical condition characterized by inflammation of the lining of the stomach, known as the gastric mucosa. This inflammation can occur acutely or chronically, resulting in a variety of symptoms, which can include abdominal pain, burning in the stomach, indigestion, nausea, vomiting, a feeling of bloating, loss of appetite, and even gastric hemorrhage in more serious cases. Gastritis can be caused by several factors, such as Helicobacter pylori infection, excessive use of nonsteroidal anti-inflammatory drugs, excessive alcohol consumption, chronic stress, and others. The treatment of gastritis depends on its underlying cause and the severity of the symptoms, and is generally based on medications to reduce gastric acidity, antibiotics, in the case of H. pylori infection, and changes in diet and lifestyle. An accurate diagnosis and medical advice are essential for the effective management of this gastrointestinal condition. 1. Abdominal pain. Abdominal pain is a common manifestation of several gastrointestinal disorders, including gastritis. In the context of gastritis, abdominal pain often manifests as an uncomfortable sensation in the upper abdomen, just below the sternum. This pain can vary in intensity, ranging from mild discomfort to acute pain. It is the result of inflammation of the gastric mucosa and irritation of the stomach lining, which can be caused by factors such as the presence of excess gastric acid, irritating foods, Helicobacter pylori infection, and chronic use of nonsteroidal anti-inflammatory drugs. Abdominal pain associated with gastritis often worsens after meals and may be accompanied by other gastrointestinal symptoms such as heartburn, indigestion, and nausea. Treatment of gastritis-related abdominal pain involves treating the underlying cause, which may include medications to reduce gastric acidity, antibiotics to eradicate H. pylori infection, and diet and lifestyle adjustments to minimize stomach irritation. In cases of severe or persistent abdominal pain, it is important to seek medical attention for evaluation and appropriate guidance. 2. Burning in the stomach. A burning sensation in the stomach is a common symptom of gastritis and occurs due to irritation and inflammation of the gastric mucosa. This uncomfortable sensation is often described as a burning or stinging sensation that originates in the upper abdominal region, just below the sternum. The burning sensation may be aggravated after meals, especially when irritating or spicy foods are consumed. Excessive gastric acidity is often the cause of this symptom, as it can eat away at the stomach lining and lead to this unpleasant sensation. To alleviate the burning sensation in the stomach, people with gastritis are advised to avoid foods that exacerbate symptoms, such as pepper and caffeine, and to opt for a light, easily digestible diet. Furthermore, appropriate medical treatment, including medications to reduce gastric acidity and treat the underlying cause of gastritis, is essential to control this symptom and promote healing of the gastric mucosa. Consulting a healthcare professional is essential for an accurate diagnosis and an appropriate treatment plan. 3. Indigestion. Indigestion, also known as dyspepsia, is a common symptom associated with gastritis. It is characterized by an uncomfortable or painful sensation in the upper abdomen, often accompanied by gastric fullness, frequent belching, burping, and malaise after meals. The underlying cause of indigestion in gastritis is related to irritation of the stomach lining, which can interfere with the organ's ability to effectively digest food. Furthermore, excessive production of gastric acid can further aggravate this symptom. To alleviate indigestion, it is advisable to avoid foods that can irritate the stomach, such as fatty, spicy, and acidic foods, and opt for smaller, more frequent meals to reduce pressure on the stomach. Medical treatment of gastritis, which may include medications to control gastric acidity and treat infections, is critical to relieving indigestion and promoting healing of the stomach lining. Consulting a healthcare professional is essential for a proper diagnosis and effective treatment plan for gastritis and its symptoms, including indigestion. 4. Nausea and vomiting. Nausea and vomiting are symptoms often associated with gastritis, especially when the inflammation of the stomach lining is severe. Irritation of the gastric mucosa can trigger the body's defense response, leading to a feeling of nausea and, in more serious cases, vomiting. Nausea is generally described as an uncomfortable feeling in the stomach, often accompanied by excessive salivation, sweating, and paleness. Vomiting can vary in severity, from regurgitation of gastric contents to more intense episodes. Treatment of gastritis, which involves medications to reduce gastric acidity and treat the underlying cause, often helps relieve these symptoms. However, it is important to seek medical advice if nausea and vomiting persist or are accompanied by other serious symptoms, such as gastrointestinal bleeding, as this may indicate complications that require immediate medical attention. 5. Loss of appetite. Loss of appetite is a common symptom in people suffering from gastritis, especially in chronic cases. Inflammation of the stomach lining can affect the organ's ability to secrete enzymes and gastric acid essential for digestion, and, consequently, decrease interest in food. Additionally, the feeling of discomfort, abdominal pain, and gastric fullness often associated with gastritis can contribute to poor appetite. Unintentional weight loss can also occur as a result of decreased food intake. It is important to address loss of appetite associated with gastritis with a healthcare professional, as malnutrition and weight loss can have negative impacts on overall health. Proper treatment of gastritis, which may include medications to reduce gastric acidity and following a proper diet, can help restore your appetite and prevent unwanted weight loss. 6. Sensation of swelling. The feeling of abdominal bloating is a symptom that many people with gastritis experience due to inflammation and irritation of the stomach lining. Gastritis can interfere with the proper digestion of food, leading to the accumulation of gas in the gastrointestinal tract, resulting in discomfort and a feeling of fullness. This bloating may be accompanied by visible abdominal distension and frequent belching, burping, as the body tries to relieve pressure in the stomach. Although bloating is usually temporary and related to acute episodes of gastritis, it can be uncomfortable and affect quality of life. Medical treatment for gastritis, which aims to control gastric inflammation and acidity, often helps relieve abdominal bloating. Additionally, adjusting the diet, avoiding foods that cause gas, and eating smaller, more frequent portions can reduce feelings of bloating in people with gastritis. 7. Gastric hemorrhage. Gastric hemorrhage is a serious complication of gastritis that involves bleeding in the stomach lining. Although it is less common, it can occur in severe cases of erosive or ulcerative gastritis, when chronic irritation of the stomach leads to the development of lesions or ulcers that bleed. Symptoms of gastric hemorrhage may include bloody vomit, hematemesis, and dark, tarry stools melena. This condition is a medical emergency and requires immediate attention from a healthcare professional. Treatment may involve endoscopy to identify and treat the source of bleeding, blood transfusions to replace losses, and medications to reduce gastric acidity and promote healing. Preventing gastric bleeding is one of the reasons why early diagnosis and treatment of gastritis is crucial, especially in cases of severe or recurring symptoms. Remedies. 8. Heartburn is a common symptom of gastritis and occurs when stomach acid flows into the esophagus, causing a burning sensation in the chest known as heartburn. Although heartburn is often associated with gastroesophageal reflux disease, which involves the chronic reflux of stomach acid, gastritis may play a significant role in its occurrence. Inflammation of the stomach can increase gastric acidity, making acid reflux into the esophagus more likely. Heartburn related to gastritis is often felt after meals, at night, or when lying down. Treatment of heartburn associated with gastritis involves medications that reduce gastric acidity and treat inflammation in the stomach. Additionally, it is advisable to avoid foods that trigger heartburn, such as spicy, fatty, and acidic foods, and keep the head of the bed elevated while sleeping to reduce reflux. Consulting a doctor is essential to evaluate the underlying cause of heartburn and determine the most appropriate treatment. In summary, symptoms of high glucose are crucial indicators of imbalances in blood sugar levels and can serve as important warnings of health problems, particularly diabetes. Excessive thirst, frequent urination, intense hunger, fatigue, blurred vision, unintentional weight loss, and susceptibility to recurring infections are signs that should not be ignored. However, it is vital to highlight that these symptoms can vary between people and are not definitive diagnoses. Therefore, anyone experiencing these symptoms, especially persistently or together, should seek appropriate medical evaluation. The concepts discussed in this video are critical to raising awareness about the signs of high glucose, but only a healthcare professional can provide an accurate diagnosis and personalized treatment plan. Do not underestimate the importance of seeing a doctor for individual assessments, as early diagnosis and appropriate treatment are essential to effectively control blood sugar levels and prevent long-term complications. Thank you for taking the time to watch this informative video about the symptoms of high glucose. Sharing this knowledge with friends, family, and colleagues can be a simple but powerful action that can make a difference in someone's life. Share this video so more people can be aware of the warning signs of high glucose and take early action to protect their health. And don't forget to watch the next video that will appear on your screen to continue learning about health and well-being.